For our movement analysis video, we decided to analyze the movement of a squat and the biomechanics and the kinesiology of the movement. The students involved are Alana Jordan Utt, Noah Kuntz, Presley Marasini, Kendall Ray, and Caitlin Roberts. All students are in the occupational therapy program at Northeastern State University. Let's get started. In phase 1, the body is stationary with feet shoulder-width apart, knees, hips, and elbows are extended, and the arms are pronated. Most joints are in extension, which holds up the surrounding structures of the body for support. We would like to note that the talocrural joint, which is your ankle, is in plantar flexion throughout the movement, allowing maximum weight distribution for body weight. Justin's postural muscles are engaged and are gravity resisted throughout the movement. In phase 2, we will be looking at the glenohumeral joint, which is the shoulder, and the surrounding joints that assist movement, like the sternoclavicular, acromioclavicular, and scapulothoracic joints. The elbow joint is gravity eliminated because it is moving in a different plane, so it won't be affected. The shoulder is a concentric contraction of the upper body, and the elbow is gravity assisted when in pronation. The lower body is still in extension, similar to phase 1.
In phase 3, the upper body is going to remain unchanged. However, the lower body is now going into flexion, resembling an isotonic concentric contraction, where gravity is assisting the motion and lowering. The acetabulofemoral joint or the hip joint is going into hip flexion while remaining in abduction. The tipofemoral joint is going into flexion, and the talocrural joint is remaining in plantar flexion to keep the body stable, resembling an isometric contraction, also gravity assisted. In phase 4, the upper body is still going to remain unchanged. However, now we're going from a sitting to a standing position, so the hip or acetabulofemoral joint and the tibiofemoral joint are going to have isotonic eccentric contractions because they're moving from a state of flexion to extension. They'll both be resisting gravity in this motion. The talocrural joint is still gravity assisted in that it's an isometric contraction where it's providing stability for the body. In phase 5, while on standing, the arms are moving from a position of gravity resistance to a position of gravity assistance, and that the scapula joints, the sternoclavicular, acromioclavicular, and the scapulothoracic joints are performing an isotonic eccentric contraction, returning closer to the body. The glenohumeral joint is going from flexion to extension, also performing an isotonic eccentric contraction. The other muscles of the forearm, wrist, and hand are being assisted by gravity to return to the normal standing position, which we call neutral.
Our client is Justin Beaver. He is a 65-year-old man, a retired pop star. He lives with his wife in LA and does what most pop stars do. He enjoys traveling, and he really enjoys specifically Beverly Hills within LA and loves taking pictures by the Hollywood sign. He also enjoys spending time with his grandchildren, all 17, so that manages to keep him on his toes and always busy. Justin Beaver values being independent, spending time with his family, and singing, as he is a retired pop star. He believes independence is the key to living a longer and happier life, and that's something that he really values, to be able to continue traveling independently. A few of his performance skills include for motor, reaches, bends, grips, coordinates, moves, and flow. He constantly does these motor performance skills throughout his everyday life as he is playing with his grandchildren, simply traveling. A few of his process performance skills include initiate, paces, sequences, navigates, and a lot of that does play into singing. knowing how to pace a song as well as sequence a song, or just play a game with his grandchildren, as well as traveling and navigating around the world. A few body functions include global mental functions as energy, being able to make sure that we have enough energy to keep up with his grandchildren, and travel. A few sensory functions include the vestibular, muscle functions or muscle power, muscle endurance, and gait. We want to make sure that he is able to have the strength to continue spending time with his grandchildren and doing all the things that he loves to do, such as singing and traveling. A few movement functions include involuntary movement reaction, which that can occur with his diagnoses of Parkinson's disease, specifically tremors. A few mental functions include praxis and executive functioning, which he may have difficulty with given his diagnoses. And a few body structures include the neuromuscular functions, such as the arms, the legs. They may be a little bit weaker. For context, throughout his bathroom, he does have a grab bar in the front of his toilet. He has an open floor plan and no clutter within the bathroom, good lighting. For performance patterns, his role is a grandpa, husband, father, and pop star. His routine is toileting as part of the morning/nightly routine and toileting throughout the day. And his habit is singing on the toilet. It definitely keeps him busy as he is a retired pop star, but that's something that he finds himself doing. Occupational therapies help maximize Justin Bieber's independence in toileting, allowing him to participate in the activity of daily living without depending on the assistance of caregivers. Occupational therapy helps Justin Bieber become as independent as possible in the activities that he wants to get back to doing the most, which is toileting. Specifically, he enjoys singing on the toilet, so this will improve his quality of life as well as his well-being because it is something that is most important to him.
After getting Justin's occupational profile, we learned that his goal for himself is to be able to transfer on and off the toilet independently. We as therapists recognize that this is important to him and made his goal Justin will independently transfer to the toilet utilizing his grab bars within 2 weeks. We believe this will be a motivator for him because of his desire to be independent in toileting once again. Now that we know about Justin, let's look at Parkinson's disease. Parkinson's can influence many aspects of the body from head to toes. In regard to neurodegenerative disorders, Parkinson's disease is the second most common and is more prevalent in Western societies in comparison to underdeveloped communities. This disease affects the amount of dopamine that is produced, which affects motor movements, postural stability, cognitive skills, and affective expression. It typically affects more men than women, with increasing diagnosis as individuals age. This is all found within the Conditions to Occupational Therapy book by Addison and Durrett in 2024. Referenced on this slide, also by Addison and Durrett in the Conditions to Occupational Therapy book, are common signs and symptoms of Parkinson's disease. Justin presents with these motor signs and symptoms, including tremor, bradykinesia, which is his slow movements, gait impairments, and postural instability. He also presents with these non-motor signs, including cognitive impairments, fatigue, sensory disturbances, and emotional disorder due to not being able to be as independent as he would like to be. That being said, these are just the ones that Justin presents with. Referenced above on the slide is all the most common signs and symptoms of Parkinson's disease as a whole.
Occupational therapy is evidence-based practice. When the evidence that is used to depict or link the relationship of movement dysfunction to occupational performance, we chose an article by Hayes and colleagues from the University of Utah, and they have said that evidence that Parkinson's patients have motor dysfunctions that will impair occupational performance due to the decreased functional mobility, postural control, activity tolerance, and overall dyspraxia. Occupational therapists should keep this in mind when treating patients of all diagnoses. When asked what evidence supports the need for occupational therapists to address movement dysfunction, we found a study by Gardner and colleagues that supports the use of occupational therapy to address dysfunction in movement holistically through different approaches. An occupational therapist focus on activities of daily living rather than diagnosis makes them uniquely placed to provide valuable interventions for patients with functional neurodegenerative diseases. Patients with neurodegenerative diseases have movement deficits, which OT practitioners address. The existing treatment literature highlights combining physical and psychological therapy, behavior, grading and adapting activities, coping and problem-solving strategies, and retaining abnormal movement patterns during activities of daily living. When thinking of assessments that we could use for Justin, we decided upon the Timed Up and Go and the Berg Balance Scale. The Timed Up and Go is an assessment that assesses functional mobility, balance, walking, and fall risk. It has a moderate to high validity and high reliability measure per the highest level of evidence from a systematic review. The Berg Balance Scale is a scale that is highly valid and reliable tool used to measure the balance in elderly patients as well as patients with Parkinson's disease. Balance is an essential component of the participation in activities of daily living. This is important to remember whenever we are evaluating Justin. To wrap everything up, we're just going to summarize everything that was spoke about. With the information gathered, it is important to note that occupations can differ from person to person. In our case, Justin wanted to get back to toileting independently, but this carryover can also be used in his daily life with activities such as sitting down to watch TV. Success in occupations will also allow for a better sense of well-being. Occupational therapists must have a good understanding of body mechanics and kinesiology, not only with patients with Parkinson's, but also with all patients. This will allow us to break down the occupations or areas of difficulty to determine what needs to be improved. With skilled interventions, we will assist Justin in getting back to the things he loves, such as dancing, spending time with his grandchildren, and singing on the toilet, all while keeping him as independent as possible. This knowledge will help drive our occupation-based field.
Thanks for watching!
Please subscribe.